Aloha and welcome to Maui Memorial Medical Center. My name is Amy. I am a specially trained registered nurse that will be taking care of you in the critical care unit after your surgery. We have developed a multidisciplinary team at Maui Memorial, and we will work very hard to achieve accurate and timely communication regarding your care. This is a big surgery, so we've created this short video to answer many of your questions, prepare you for surgery, and let you know what to expect throughout your stay. We are here to assist you on the road to recovery. Feel free to ask questions at any time throughout your stay. Maui Memorial Medical Center prides itself on having an excellent heart program in the state of Hawaii. Led by our cardiovascular surgeons and advanced practice providers, the cardiovascular team at Maui Memorial Medical Center can perform a number of different open heart surgeries.
The most common procedures are coronary artery bypass grafting or CABG and heart valve surgery. A CABG procedure involves using a combination of vessels from your own body to create a bypass around the blockages of your coronary arteries. A bypass procedure requires removing a vessel from another part of your body. It may involve any combination of arteries from your chest wall, arm, or veins in your leg. A valve surgery may be performed either by repairing it or replacing the valve. Your surgeon will explain what procedure you're having and answer any questions you may have.
Aloha, my name is Rob, and I'm a specialized trained registered nurse at Maui Memorial Medical Center. You will be scheduled for a pre-admission interview and instructions with the nurse over the phone 1 to 2 days prior to your surgery date. You will need to shower the night before and the morning of surgery. Do not apply lotions, deodorant, cologne, makeup, or anything in your hair. Do not shave. If you are already in the hospital, your team of nurses and patient care technicians will help you prepare for surgery. The hair on your torso, groin, and legs will be clipped by our staff before surgery. You will not be able to eat or drink anything after midnight the day of surgery. Your medication instructions will come from your surgical team in the office. Please take the medications that you were instructed to take the morning of surgery with a small sip of water as directed. There may be medications your surgeon stops. The surgical team will discuss this with you in the office. If you are coming into the hospital on the day of surgery, you will arrive at 5:30 in the morning at the front desk of the hospital. You will be directed to go to a second preoperative area and be escorted to a room where preparation for your surgery will begin. We will confirm your contact information, verify your home medications, bring your medications with you or a list of medications including the dose and frequency, confirm allergies and sign consent forms, perform the clip prep to remove hair as needed, secure your personal effects including any vision, hearing, or dental equipment. You'll meet with an anesthesiologist, start an IV, and provide you with medications to relax and a preoperative antibiotic. Lastly, we'll answer any questions you have about your surgery. Once all the preparations have been completed and the OR is ready, we'll perform a safety check with a pre-op nurse and your OR nurse, and then you'll be taken to the operating room. The average open heart surgery lasts 4 to 6 hours. A bypass procedure will require removing a vessel from other parts of your body.
Aloha, my name is Zion and I'm one of the open heart recovery trained nurses here at Maui Memorial Medical Center. When your surgery is complete, you will be taken to your room in the ICU. An open heart recovery nurse will remain with you throughout the first night in ICU. Once you are settled and stabilized, your family will be allowed brief visits. This is to reduce overstimulation. Please keep in mind that flowers are not allowed in the ICU, and this is to reduce the risk of infection. Your surgeon will speak with your family and provide updates on your condition following surgery. We suggest no more than 1 point of contact per family, as our main focus is patient care. The recovery nurse will discuss appropriate times to call for an update. It is normal to feel disoriented as the anesthesia wears off and you begin to wake up from surgery. There is a breathing tube, called an endotracheal tube, that is placed in your airway for surgery, and this is connected to a ventilator, which breathes for you during surgery and for the first few hours of recovery. It is not removed until you're awake enough to protect your own airway and it is safe enough to do so. This may cause some anxiety, but it is important to remember that this is normal and you should try your best to remain calm. Your nurse is with you at bedside to help coach you through this process. Our goal is to have the breathing tube removed when it is safe to do so or after you arrive to the ICU. While the breathing tube is in your airway, questions will be limited to yes or no answers. You will hear many different sounds coming from the equipment in the room. Noises come from the monitor near the head of your bed, the IV pumps, and from the ventilator. It is normal to feel some pain after surgery, and we will do our best to help manage your pain. It's important to remember to communicate your pain level to the nurse and surgical team. Patients often report feeling thirsty or dehydrated, and this is a side effect of the anesthesia drugs. They are designed this way to reduce the amount of secretions in your mouth. Fluids will resume slowly at first until you are able to tolerate them. As you recover and the effects of anesthesia wear off, we will progress you to a heart-healthy diet.
The morning after your surgery, the night shift nurse will help you get out of bed and into a chair around 5:30 in the morning. It is important to communicate to your nurse if you are feeling dizzy, lightheaded, or nauseous. The team will get you back into bed in the evening or earlier if necessary. Our goal is early mobility, a key element to a successful recovery. We will try to keep you out of bed for most of the day. Regardless of your activity level prior to surgery, you can expect to follow this daily routine. You will go for your first walk on the day after surgery. Your nurse and the ICU staff or physical therapy will guide you through this process. Each day, you will increase the distance and number of walks you take. You will be given a firm pillow. We want you to bear hug this pillow when you cough. This is a splint for your chest. It will guard the muscles that they were operated on. It will help stabilize your chest when you cough and will help control some of the pain. Coughing will help clear secretions from your lungs and assist in your recovery. You will be provided an incentive spirometer. This device is designed to exercise and re-expand your lungs. The incentive spirometer is a critical tool in the prevention of post-operative pneumonia. The average hospital stay is 5 to 7 days for a scheduled surgery. Our program is designed to optimize the continuity of care throughout your stay.
When discharged, you'll be given instructions for your return home. This will include limitations, wound care instructions, medication schedule, follow-up appointments, educational information, and information for home care and cardiac rehabilitation. Goals for your individual progress will be set to meet your specific needs. There are 5 key goals to reach before you can be discharged safely from the hospital. You must be thinking clearly. It is important that you recognize changes in your recovery and communicate your needs effectively. You must be able to increase your activity and mobility each day throughout your stay. You must be eating, and your digestive function must be returning to normal. Nutrition is a critical component of the healing process. Pain must be controlled with oral medication. You must accomplish your incentive spirometer goals. The incentive spirometer is a key device in the prevention of post-operative pneumonia and optimizing your lung function. You'll receive a complete set of discharge instructions and education related to your stay in the hospital that your nurse will go over with you. Here are a few key items included in those instructions. No pushing, pulling, or lifting more than 10 pounds for the first 6 weeks. You will have a follow-up appointment 1 to 2 weeks with your surgeon after you are discharged. It is preferred to have someone stay with you most of the time for the first 1 to 2 weeks after you go home.
Your cardiovascular team, the staff in the intensive care unit, and everyone at Maui Memorial Medical Center
is here to provide you with the best cardiovascular care available in healthcare today.
We wish you well in your recovery and mahalo for choosing Maui Memorial Medical Center.